Did you see that there's a new medication to prevent HIV? So the new medication is called Yeztugo, which is the first and only twice a year injectable to prevent HIV. So let's go through the drug facts together and what you actually need to know about this medication. So to be on this injection, you have to weigh at least 35 kilograms, which is around 77 pounds. And so this dosing is very unique, so we need to go through it together. So when you first start on day 1, you're going to be getting 927 milligrams subcutaneously. So it's two 1.5 ml injections, as well as you're going to be taking 2 oral tablets. So they're going to be 300 milligrams apiece. And then on day 2, you're going to have to take those 2 tablets again. If for some reason you missed the day 2 dose, just take it as soon as you can, but don't take them on the same day together. Like, don't take all 4 tablets together. Then every 6 months, you're just going to be getting 2 injections. And so from my assumption, you're most likely going to have to go into a provider's office to get it administered, because it's going to be coming in these vials, and then they're going to have to draw it up and then inject it in you. So it looks like it can be injected around your stomach area and then your thighs. And then when it came to adverse reactions, most commonly is going to be injection site reactions, also possibly headache, nausea. So how does this medication actually work and help prevent HIV? So Yeztugo actually binds to multiple sites on the HIV-1 capsid, which the capsid is like the protein shell in the virus. And it also interferes with multiple stages of the HIV life cycle. So it prevents viral entry into the nucleus of human cells, also blocks viral replication by disrupting capsid disassembly, and also inhibits new virus assembly and packaging. This makes it effective by not only stopping HIV from infecting new cells, but also from creating new viruses within already infected cells. And trust me, HIV can be really confusing, so let's break it down into analogy. So imagine HIV being like a thief trying to break into a building. So think of like the building being your cells. So most HIV drugs may either stop the thief at the door, so our entry inhibitors, distract the thief from picking the lock, so our reverse transcriptase inhibitors, or block the thief from making copies of stolen data, like our protease inhibitors. But as we saw, Yeztugo works a little differently. So it goes for the actual toolbox that the thief, which is the HIV, is carrying. So think of that toolbox as the capsid, because it holds all the tools and the blueprints that the thief needs to break in and steal everything. But Yeztugo locks up that toolbox so the thief can't break in properly, he can't use any of the tools, and can't steal or copy anything. No matter how sneaky the thief is, if they can't open up the toolbox, this whole heist falls apart. That's how Yeztugo stops HIV before it can even get started.